Recording. Okay, so today we're gonna do the breathing exercise itself is just gonna like blend into the rest of the stuff. I was saying before to Britt that, and Gladys, that earlier today I was working on some diaphragm stuff, just like playing with some exercises I was reading about. My neck hurt this morning and my neck doesn't hurt anymore. And I was like, this is amazing. I didn't do anything for I didn't even think about my neck. I was just like, oh, like playing with my rib cage and stuff, and my neck doesn't hurt. And I think that just goes to show the power of like hey, Shy, our diaphragm is the most, like one of the most important muscles in our bodies, aside from like our hearts and things, but it is the breathing muscle, right? So if we can take care of it, that's good. And also, if we work on our rib cage movement and like the diaphragm itself, it's helpful for, if you think about where your shoulder sits, it like lines up nicely with your rib cage or not, depending on how you're built or what imbalances you have. So if you have a rib cage that moves, you have a shoulder that moves, and then you can reach for stuff. Our diaphragm is also very closely related to our pelvic floor. So if you have a good working diaphragm, your pelvic floor can more easily work. And there's a lot of issues that come from pelvic floor dysfunction. So all that to say is our diaphragm is super important. So let's pay attention to it, shall we? For a brief moment today, but hopefully you can take some of this out into your lives. So I'm going to stay seated just to guide this, but if you can find a spot on the floor, we're just going to do a little bit of breathing and feeling how our body moves when we breathe. So it doesn't have to, nothing fancy, just somewhere on the floor. Hey, Tanya. Diaphragm. So we're going to lie down to feel how things move. So lie down on your back. Get comfy, cozy. If you want to close your eyes, that's sometimes more helpful to like feel into the body, but up to you. Great. Appreciate the shifting of the computers so I can see everyone. Except some people disappeared. That's fine. All right. So just, no, you're fine. I don't need to see you. So just relax there on the ground. And just for the first few seconds, just breathe normally. Try to relax into the position, get really comfortable. Just, an opportunity to notice, as usual, what is happening in your body. If anything feels tight, tense, or things that feels really good, like when you lie down, sometimes that creates space for like pain-free movement. You can like relax some muscles, and maybe some things that bother you don't when you're lying down. Just, again, noticing. And I want you to inhale deeper than normal. You don't have to do like these huge, like really expansive inhales, but breathe in deeply. So as much as you can comfortably. So at a certain point, breathing in very deeply gets a little bit uncomfortable. So try not to get to that point. This is supposed to be like comfy, cozy, and just in and out. Now deepening your inhale every time. And you're gonna maintain this pattern of breathing for the next little bit. And what I want you to start to notice is what happens in your lower back as you breathe. Our diaphragm actually attaches into our lower back on the front of our vertebrae. So that's why this is important. So nice big breaths, again, not uncomfortable, but nice and deep. So you have the time and space to actually feel like the air needs to get down into your low back, or maybe not. It depends how you are in this moment, but breathing deeper allows that expansion a bit. So feeling into the lower back. First, just seeing kind of what your body does. You don't have to change anything, just feel it, notice. And then try to pay attention to whether or not your lower back lifts as you inhale. Does it lift off the floor, or maybe it presses into the floor? Just notice that specific movement. Is that changing at all? And now try to think about and then do how you can maybe allow your lower back to expand backwards. So as you take a deep breath in, can you get your lower back to press into the ground gently without using, like, without squeezing your core muscles? Make it be your breath that's doing that movement. So basically, what I'm asking you to do now is really try to use your diaphragm more. Or maybe you're already doing this and that's fine, then just keep going. But as we use our diaphragm more, so your ribs move more and you're actually creating more movement in your whole torso and your abdomen as you breathe. So breathing in, you should create more pressure in your abdomen, your belly, your low back area, because the space is getting smaller. Your diaphragm's moving down. So it's pulling down, so your lungs are expanding with air. Fun physics lesson. And that means that the space in your abdomen gets smaller, so it should expand out. And therefore, your back could press into the ground. And then as you exhale, your diaphragm relaxes, your lung space gets smaller, and your abdomen gets more space, so it can just go back to kind of neutral. So try to keep noticing. If your mind wanders, that's legit. Try to bring it back to that breath and just noticing this lower back. And also notice, for anyone who has any back pain, typically, or lower back tension, like how this feels. Is it aggravating that pain, or is it maybe letting it release a bit? Typically, this pumping motion in and out, like it's like a rocking for your spine and your tailbone and your pelvis, is good. It's like a pain suppressant, natural. Um, it's okay if it's not. It's not, everyone's different, of course, but it's a good thing to notice. If it is easing your back pain or any other tension in your body, that is good. And again, it's like this little tool you can take home. You're already home. You can take away from movement moments and practice. Very simple. You've been doing this for about 5 minutes. So just sort of a point of reference, how it can take very little time to relax your body, or it might take longer. So I want you to let go of that breathing pattern. Just stay on the ground, relaxed, but let your breathing just go back to how you breathe normally. And just rest. You worked hard, thinking a lot. Just rest from that and sense your body. Whatever that means for you, just feel it out. Is it any different than before? Anything you notice? And we're going to move into staying on the ground. Another little sort of more active, playful thing. I want you to put your feet on the ground so your knees are bent. So feet flat on the floor, knees bent. Place one hand on your belly and sort of over your belly button, and one on your chest. And find a way to do this where it's comfortable. You can relax your shoulders. I find sometimes when I do this during like yoga or meditation, I get very tense in the shoulder that's on my chest, and that might be an emotional thing. But I find that if I find a different position where I'm not like thinking about what it should look like, I just like put my hand on my chest in some way. The point is that you feel your chest movement. You don't have to have it exactly in one spot. So place it somewhere where your whole arm, whatever hand is on the chest, the rest of the arm, shoulder, jaw can all relax. And from here, you want you to inhale a full breath and hold it. Again, not into like discomfort, just nice full breath. Hold it. And without letting the air out, push the air down towards your pelvis. So you press your belly out and then push it back up to the top of your chest. And go back and forth like this. So you're playing, you're actually moving where that air goes. In theory, you're moving where the pressure goes. Exhale when you need to, and then start again. So I'll leave that breathing up to you. Just do whatever's comfortable. But the activity and the play is in moving that breath, like seeing how you can or can't, like where it's challenging and where it's easy to push that air around in your body. So your your two different hands should be rising and falling in opposite time. So again, keep doing this as long as you can per inhale, but don't make it stressful. Your heart rate shouldn't come up. You should just be nice and calm. If you can hold your breath for 2 seconds, that's fine. If you can hold it for longer, that's also fine. And as you do it, I want you to think about how your abdomen expands. So abdomen, like where your hand is on your belly button. Can you feel movement in the back of yourself like we were doing before? So can you feel as you press the air into your belly? How can you feel your back? What's happening there? Is it pressing? Is it moving? Is it hard to get it to move? Just feel out that sensation. And then also, as you do this, try to feel the sides of your waist. How did they expand? Do you feel it down into your pelvic floor? Like just, again, feeling any sensations, but noticing that it's not just your belly rising, other things are happening. And then when the air is in your chest, so when you've pushed the air up into your chest, how does that expand? So same idea. Do you feel this equally in the front, back, sides of yourself? Or is one dominant, one side? Do you feel it more on one side than the other, or in the back more than the front? Again, sort of figuring out where you're feeling things. And super important, do you feel it in your neck? And so I'm just going to give you a few minutes of silence so that you can keep going with this movement and all these things, these ideas of where you're feeling it. And how much can you reduce the effort? So I want you to play with evening things out. So, like trying to feel it equally in the front, sides, and back in your chest and abdomen. So even it out a bit and then just try, like, how can you just make it the least amount of movement? How can you get your neck out of the picture? Just let that calm down, relax. And I want you to just play with the idea of doing as little as possible, but continuing this movement. And starting to wrap this up. So maybe do your last inhale and play around with that movement. And when you're ready, just go back to normal breathing. And again, rest. That was a lot of thinking, probably sort of focusing attention to places that don't usually get attention, which can be really kind of stressful sometimes and tiring, but I hope it wasn't stressful. But do take a break, relax, breathe normally, and just again, feel into how your body feels now. Just for a few seconds. Beautiful. All right, you can slowly get up, come back to a seated position. You did a great job, even though I couldn't really see you. I believe in you. And if you can, some people are sitting on the floor. Sitting on a chair for this would be best for this next part. Having you move a lot. It's like meditation plus like get up and sit different places. Okay, great. So exciting. I was playing that with that today and I loved it. I thought it was very interesting. I feel like I discovered a lot of things about my body doing that. So I hope you did too. And now just to get a little bit more movement and like we're up and gonna go on with our days. I just want to show you how, and again, this is different for everyone. So if you're like, this doesn't make a difference for me, it's fine. Check it out, see how it feels. But it's a way to see how our rib cage and diaphragm are really linked to our shoulder and hip movement. And if you have hip or shoulder pain, this could be a good trick to get some movement in a joint that is achy or painful in a non-achy or painful way. And that's always really good for rehab. So if you can move without pain, your body's like, oh, cool, I'm into this. Like, well, I'll let you move that shoulder more often. So let's start with shoulder. What I want you to do is pick a side. We'll do both sides, but pick a side and put your arm up like this. And then just do some internal rotation. So bring your palm towards the floor and just see how that feels. It might be limited, like you might stop here, you might stop here, whatever. We're not sort of judging what's happening, but do feel out like your end of range and what that feels like the quality of movement. And then come back to neutral here. And I want you to take a breath in and blow out through your mouth. And really try to collapse your rib cage so you're emptying it as much as you can. And when you're totally empty, retest that movement. So hold on empty and see how that feels. I just went like way more. And when you're ready, just relax and breathe normally. Did anyone, you're all raising your hand. Did anyone have a difference, an improved range of motion? Put your hand down if you did. Improved range of motion. Stayed the same. All right, cool, that's it. Next side. So again, test this one, see. Again, for me, this feels terrible, I hate it. This one was fine, this one feels awful, I hate it so much. But I have pretty good range, we'll see. And again, coming back to neutral, take a nice breath in. And blow out all the air. So your rib cage is sort of collapsing in on itself. Your abs are engaging. You're trying to get super empty. And then on empty, retest that movement. For me, still feels kind of terrible, but not as bad. Britt is nodding, this is good. And then just let it go. If you cough with that deep exhale, super normal. It can be really, like we don't do it often, but it's good. It's a diaphragm stretch and it is normal to get like a little bit. So that, again, cool things to test and retest. If you're like, I really want to get better range, do that a few times. And then like my range feels way better all of a sudden. And you can do it. The other way would be with a deep inhale because you're sort of arching your back. But we're doing stretching of the diaphragm right now. So let's do hips. So now sitting sort of on the edge of your seat, the tension. I just want you to bring your hip up towards your knee what? No, your knee up towards your chest as far as you can, sitting up like nice and tall. And again, feel the quality of movement. For me, there's a pinching in that hip. Don't love it. And then bring your hip back down. And same thing. Inhale and then try to stay up tall, but do let your ribcage sort of collapse, get that abs engaged, the ribs fold in, you're stretching your diaphragm. And when it's on full stretch, so you're empty of air, bring that hip back up. I feel no pinch. It's a miracle. And then let that go. We'll get the other hip in. So test it, bring it up. Try to stay nice and tall for both. You want to stay sort of like in the same posture for testing and retesting. So bringing it up, feel it out, like the quality of movement, any pain or tension you feel or not. And exhaling, letting those ribs move in the way they do when our diaphragm is on full stretch, empty of air. And bring that hip or the knee up towards the chest. See how that feels. And you can relax there. Any change in hips? I did on the right. My left one felt bad both ways. So just goes to show it's not like a cure-all for all the things. But it is a great way to realize how much your diaphragm and your rib movement does affect other things. And so if you're looking for a sort of a trick to go along with your rehab or just like play with your body, see what's feeling good or bad, that's a really good one, stretching that diaphragm. So exhaling entirely and trying different movements, including like bending over. You need space to bend over and your ribs need to move. So sometimes people with back pain will bend over like in a very stiff way. But like I've said before in these things, when you're folded over, like let your abs go, be floppy, let your ribs collapse and your diaphragm stretch, and you'll probably get more range and it'll be pain-free. And so with our last few minutes here, we're just gonna do our last 3 deep breaths like always. So deep breath in, squeezing your shoulders up towards the ears. And on your exhale, let them go. Do one more like that. Squeeze, squeeze, squeeze. And go. And on the last one, breathing in. Squeezing, but this time on the exhale, rolling them back. Sitting up nice and tall. You did it. Great work, everybody. I hope that felt good. Go lie down throughout your day and just breathe. The moral of the story. It doesn't have to be complicated.
Thank you, Steph. That was awesome.
You're very welcome.
Thank you.
Thanks,
Steph.
Welcome.
Thanks, Steph.
Hey, Shai, thanks for coming. Good to see you.
Yeah, good to see you. Yeah.
Alrighty. Have a great day.
You too, Steph.
Thanks. Bye.